welcome to In Europe. I'm Captain Moreau. I'm a primary care nurse for the GK clinic. So it will be my pleasure to introduce you and everyone to this video for our services in Europe. So first of all, we're a really small detachment of the Ottawa clinic. We only have 22 staffs working here, including civilian clerks and healthcare providers. Out of that staff, we only have 2 doctors, 2 physician assistant, and 1 nurse practitioner part-time. So we see patients for sick parade inpatient, but and also for family practice. We don't have the capacity to keep people overnight, and emergencies are usually referred to the local hospital. So we are located in Geilenkirchen area, just a few minutes from the GK NATO base and GFC Brunson. Our area of responsibility, although, is really larger than that. So we do cover all Europe, UK, Russia, Middle East, and North Africa. So it's really an extensive zone with at least 70 different locations. Our responsibility is to have a clinical oversight of all the CAF members across that area. And what differentiates us from the other clinics in Canada is our responsibility to provide cares to and clinical oversight to the CAF members, but also to their spouse and their children. And we also deliver cares to CAF employed civilians like PSP staff and the teacher at the Canadian sections of the international schools. Since all these persons are posted abroad, we have to make sure they're receiving appropriate cares up to Canadian standards. Of course, since most of our population is remote, or what we would consider remote from our immediate region, this means our typical schedule is roughly 30% in-person cares and 70% telehealth. So to make sure our families are receiving the appropriate cares in timely cares, we ask them to find a family doctor when in their location when they arrive out in their new posted location. Although we're always reachable by phone and by email to support members and their families through their care episodes if they want a second opinion from a Canadian clinician. CAF members remain eligible under the spectrum of care, like in Canada, and they still have the duty to report their to the CAF medical records and all any kind of new event that would bring them, give them MELs. Also, we need to approve every consultation outside of family practice. So every time you would see a specialist, or you would be recommended for a procedure. CAF members only, not the families, but CAF members only have to communicate with us and get our approval. Also, when members and families inform us of their situation as soon as possible, it enables us to support you remotely and to provide you with our recommendations. Remember, it can be complex to even access standard routine cares when you're in a foreign country with foreign culture and foreign language. So most of the time, you might be remote and you might be the only family there, but it's not because you're alone at that place at that moment that we haven't met something similar in the past. So we'll be more than happy to support you and to provide you with all the recommendations we can. That's it for me. So I'm gonna pass the video to Jamie, our community health nurse.
Thanks, Fred. As he said, I'm the community health nurse here at the GK clinic, and I offer a wide variety of services. The main focus of my life for the past year has been COVID vaccinations and the provision of them locally and remotely, and helping make sure all of our members and dependents are able to access the COVID vaccination, and hopefully that's starting to wind down. I also offer travel health advice. Many of us here in Europe and abroad are traveling a lot with our families. So it's important to go to a travel health clinic, or you can contact me to see what vaccinations are required for your trip, or if there are any other travel advisories that you need to be aware of to keep you and your family safe. I also help maintain routine childhood immunizations. So if you have any questions on what's required for vaccinations for your children, please don't hesitate to contact me. It's really, really important to keep your kids up to date for the routine vaccinations, especially before you go back to Canada, just to make sure they meet all the standards for the Canadian guidelines for that. And that's it for me. As Fred said, we're here to help. Please reach out anytime you need, or if you have any questions. Living out camping medically especially can be really, really confusing, and we're here to help.
One last thing is we do have female and male practitioners. We do speak both official language, so feel free to reach out anytime. We're both available. There's other members of the clinic that would be more than happy to support you. And again, welcome to Europe.